Palliative care and the palliative approach is the kind of care that aims to improve quality of life for all kinds of people, not just those with cancer. Unfortunately, there are many illnesses that are severe, that will progress, and that are not curable. We can think of illnesses like cardiac failure, lung diseases, hepatic liver failure. We can think of kidney failure. There are also neurological illnesses like Parkinson's disease and Alzheimer's disease. None of these illnesses can actually be cured. Medicine can try to stabilize, maybe prolong life, but mostly medicine can accompany people who have these illnesses. The palliative approach should be integrated in the care of these people. It's about helping people live better with their illness and take care of the symptoms, whether they be physical, such as pain, nausea, shortness of breath, but also other kinds of suffering, things like psychological distress, existential or spiritual suffering. The other thing that's important to remember is that patients, when they get diagnosed, they're not by themselves. They are actually part of a family. And when they are affected with illness, the entire family gets affected. So the palliative approach and palliative care is about taking care not only of the patient, but also of that family and help accompany them. Now, palliative care and the palliative approach can take some time and also a little bit of expertise for some people, especially when they have more complex symptoms. Not all treating physicians have the tools, the knowledge, or the time to be able to take care of all of these problems. So they may refer to a specialized palliative care team. And that team is going to be made up of all kinds of different professionals to try to take care of all of these problems. You have social workers, you have people like psychologists, there are pain specialists, there are physiotherapists, all kinds of people who are there to try to take care of the patient and the family and help them through this illness. As well, there is the home care team that might need to be called upon if the condition of the patient requires it. This allows for the patient to be at home and receive care in the comforts of their own home for as long as possible, and potentially right till the very last breath. The teams that are part of the home care team, again, include all kinds of different peoples, such as physio and occupational therapists. There's nurses, there's dietitians, doctors and nurses who can come to the patient's home and help them with whatever it is that they might need to have a better life at home. So, with all of that care that we can start much earlier on in the illness trajectory, we can actually bring about much better life, quality of life to the patient, to the family, and it doesn't need to be in their last dying days. It can be right from the get-go if necessary. And there are people there who are there to support you.